everyone, and welcome to our Plasminogen Deficiency session. My name is Julie, and I work for Promedic under the Rare Disease Division. We are pleased to have Dr. Shapiro and Dr. Nakar with us today, who will be answering some common concerns that patients might have once diagnosed with plasminogen deficiency. They both have many years of experience helping patients dealing with this rare disease. Before we start, we also have another session today where Dr. Shapiro provides general information about plasminogen deficiency. Make sure to tune in later. I will leave you now with Dr. Shapiro and Dr. Nakar. Thank you very much for your participation, and we hope you'll enjoy this presentation.
Hello, I'm Dr. Amy Shapiro. I'm a pediatric hematologist, and I'm medical director of the Indiana Hemophilia and Thrombosis Center. I have a long-standing interest in plasminogen deficiency and have been involved in seeing patients with this disorder for many years.
Hello, I'm Dr. Charles Nakar. I'm a pediatric hematologist at the Indiana Hemophilia and Thrombosis Center, and I have special interest in plasminogen deficiency diagnosis and management.
We're going to review today congenital plasminogen deficiency, frequently asked questions posed by our patients and families.
Okay, Dr. Nakar and Dr. Shapiro, thank you for joining us today. I have a few questions that the patients ask us all the time. The first question is, how do you get plasminogen deficiency? Is it catching?
Plasminogen deficiency is an autosomal recessive genetic disorder. In order to be affected, one should inherit one abnormal gene from each parent. Abnormal gene is called a mutation. There are several known mutations, but likely more mutations exist. Both inherited mutations can be the same mutation or different mutation. We think that not all mutations are the same.
So in short, Dr. Nakar, it's not catching, is it? It's inherited.
Correct.
Okay, so next question. So if I have this deficiency, can my children inherit it from me?
A patient with plasminogen deficiency has two abnormal genes, so each child would get one copy of the mutation.
So they're not inheriting the deficiency, they actually carry a mutation for that deficiency. Is that right, Dr. Nakar?
Yes, that's right.
Okay. Next question. So if I carry this deficiency, can I develop symptoms?
That's a very good question. We don't know enough information to determine if people who carry one copy of an altered gene will actually develop symptoms. It likely depends upon the level of the plasminogen activity that one abnormal gene confers to that individual patient. In general, we have seen that most individuals who carry plasminogen deficiency or who have one abnormal gene do not have symptoms, but we cannot absolutely rule out the fact that some individuals who carry this disorder may have some symptoms if their level is low enough.
Okay, thank you. The next questions I have is on therapy. My doctor said that if I have surgery to remove my lesions, do you think this is the best approach? And what roles does surgery play in the treatment of this disease?
This is really a complicated question. Lesions after surgical removal tend to recur, and even in a faster fashion and larger, due to the direct injury to the tissue by the surgery. Surgery should be done under the cover of medical intervention that increases plasminogen level locally or systemically in order to avoid recurrence. In some cases, surgery must take place. For example, when lesions cause life-threatening airway obstruction. Another possible indication for surgery would be large lesions of the eyelids in infants that block their vision. In those cases, surgery needs to take place in order to prevent lazy eye and secondary vision impairment. In the future, replacement therapies, which are currently unavailable outside of clinical trials, will hopefully decrease the need for surgeries and improve surgical outcomes.
Thank you. The next question. Would things like vitamins or any other over-the-counter medications help to relieve my symptoms or prevent lesions?
The over-the-counter medications and vitamins are what we would call non-specific therapies. Some of these medications may help relieve some of the symptoms associated with lesions, such as irritation, redness, or tearing of the eyes, but they won't necessarily prevent lesions, or they won't treat lesions once they are there. As far as we know, there is absolutely no evidence that vitamins or over-the-counter medications that are currently available help to prevent lesions in patients with plasminogen deficiency.
Next question. Is there a cure for this deficiency?
At this time, there is no cure for plasminogen deficiency. What we hope in the future is that there will be adequate specific therapy to treat plasminogen deficiency.
Next one. Again, on therapies. What therapies are available to treat this deficiency?
So this is, again, a long answer, so just bear with me. Multiple medical therapies, topical and systemic, were used and still used to treat, or at least to alleviate, the symptoms of the disorder. These modalities are usually based on individual case reports and are not consistently efficacious. The list is long, but from all, fresh frozen plasma, locally or systemically, seem to have some success. It can be given as eye drops or IV, but is not very efficient due to the overall low plasminogen level it contains. Plasminogen concentrates, topical and systemic, have been intermittently available and have demonstrated efficacy. Plasminogen concentrates are currently unavailable outside clinical studies. Until plasminogen concentrates are licensed and commercially available, I think that fresh frozen plasma, with or without additional medications, are the best we have.
Okay. Thank you, Dr. Nakar. The next question, what studies have been done on different therapies to treat this deficiency?
Currently, there are two therapies in clinical trials. One is the plasminogen concentrate eye drops, and the second is the IV plasminogen concentrate. Both, by increasing plasminogen levels locally and systemically, have shown promising efficacy results. The eye drops, of course, help only with eye lesions.
Thank you. Well, if a patient is on treatment, like, if they are on therapy, how long will they need this treatment? And if they require for lifelong treatment, would intermittent therapy work?
These are very good questions, and ones we hope to answer by doing a prospective study looking at patients. At this point in time, we know that the clinical trials with the plasminogen concentrates show that they are able to reduce lesions either in the eye for the plasminogen eye drop concentrates or systemically when IV plasminogen concentrate is administered. What we do not know is how long a patient needs to be treated and whether therapy is required for their life or intermittently as lesions resolve. We hope in the long term to better predict a patient's course and to understand those markers, either plasminogen level, genetic mutation, other coagulation factors, impact on plasminogen levels and local fibrinolytic activity, will help us in answering these questions for patients going forward.
Thank you. The next questions I have is on the disease course. What areas of body can be affected with lesions due to this deficiency?
So it's important to realize that plasminogen deficiency is a systemic disease and can affect multiple organs, including eyes, ears, nose, oral cavity, sinuses, GI, genitourinary tract, respiratory, including airways and lungs, and rarely the central nervous system.
Okay. And so if my child has lesions in their eyes or any other area, what is the likelihood that they will develop lesions in other areas also?
This is another currently unanswered question for patients with plasminogen deficiency. We cannot predict an individual's course with this disorder. If they present with eye lesions, we don't know the likelihood of them developing lesions in other areas over the course of their lifetime. What we do know is that individuals who have very low levels, probably levels below 5%, are at higher risk of developing either persistent or multi-system lesions.
Thank you. The next question is, are all these lesions painful everywhere? If I have it everywhere, any other place, are they painful? What symptoms should I look for if I have an area I cannot see maybe involved?
So not all lesions are painful, but some are. Based on the location, pain may exist. Some examples I can think of are dysmenorrhea, when lesions affect the female organ, like cervical lesions, urinary tract pain due to obstruction or stone-like lesions, gum sensitivity due to gum lesions, sore throat due to ligneous tonsillitis or other involvement of the upper airways, eye lesions, especially when the cornea is abraded, and ear pain when the middle ear is affected and the drainage is obstructed, which may even result in middle ear infection. Regarding what symptom to look for, I would suggest that any abnormal symptom you think should be addressed by a hematologist knowledgeable of the disorder. Dr. Shapiro, any comments?
I agree that a hematologist who is well-versed and understands this disease is the best person to evaluate whether specific symptoms in any area represent a presentation of plasminogen deficiency.
Thank you again. The next question, can any of these lesions be life-threatening?
So involvement of some organs may result in life-threatening events. Most notably is the involvement of the respiratory system. Lesions in the airways may lead to significant life-threatening obstruction. I suggest that any respiratory symptoms, including what looks like asthma, should be brought to the attention of a hematologist, again knowledgeable about the disorder. Patients with CNS involvement with congenital hydrocephalus may result in acute and recurrent shunt malfunction due to obstruction. In theory, gastrointestinal involvement with secondary ulcer may result in GI bleeding or perforation of the GI tract.
Okay, so I want to go back to family members. There are other people in my family who are affected. Why do I have symptoms and they don't?
I think this question goes back to the issue of why any individual becomes symptomatic at a particular level. And again, we don't have a good answer for that question. We do know that siblings who have the same level may present with one individual who is symptomatic, whereas the other individual remains asymptomatic. So we can't really answer why one individual has symptoms and the other does not. But again, we hope with a study that will be conducting in the future that we can help provide information to predict a patient's course over time.
Next one. I have developed lesions at times and then they go away only to come back years later. Why do some lesions, they come back and they come and go away over time?
So in addition to what Dr. Shapiro just said and her answers for some of the questions before, truly we do not know exactly why lesions come and go and why lesions are quiescent at times. The answer could be related to genetic or acquired reasons like infection or inflammation. In order to understand why some people are chronically symptomatic while others are intermittently symptomatic or even asymptomatic, the study Dr. Shapiro mentioned earlier is important in finding markers that alter the course of the disease and allow prediction. Furthermore, this information that we are hoping to achieve will allow the clinicians to tailor therapy to a specific patient once plasminogen concentrates are available.
Next question. What things seem to trigger the development of the lesions? Are there things I can avoid or watch out for to help prevent lesions from developing? For example, immunizations, swimming pools, pets, etc.
So for sure, you need to get all the recommended immunizations. Infections are likely to trigger inflammatory response and the development of lesions. For example, conjunctivitis or upper respiratory infection or pneumonia may trigger the development of ligneous lesions in the eyes, vocal cords, tonsils, and lungs, respectively. Regarding swimming pools, no data is available, but it seems reasonable that swimming may cause irritation. And I would like to touch on 2 points. We all know that some swimmers tend to have red eyes due to exposure to chemicals, including chlorinated water, or due to infection. It sounds reasonable that patients with plasminogen deficiency should wear goggles in swimming pools. In addition, we all know the phenomena called swimmer's ear, caused by inflammation or infection of trapped water in the outer canal. Utilizing earplugs while swimming may help. Of course, earplugs are not suitable for all ages, but earplugs can be customized to fit younger patients. Dr. Shapiro, what do you think about pets?
I am a pet lover, and it is always difficult to tell someone not to have a pet. I think pets are fine as long as the individual who's affected with plasminogen deficiency doesn't have any severe allergy to that individual pet. Allergic symptoms with chronically runny, itchy eyes could help trigger lesion development. So we would recommend that this issue be addressed individually.
Thank you. My next questions are on women's issues. Okay. Can females with this deficiency have children?
We know of women who have plasminogen deficiency who have conceived and had children without any specific intervention. We also know that some women have had difficulty with conception and difficulty maintaining a pregnancy. At this time, again, we don't know in any particular female how to predict whether that woman will have difficulty conceiving and maintaining a pregnancy or not. Again, we hope to find this out going forward as we do more research on this disorder. We do know that one woman was able to maintain and deliver a healthy child while receiving plasminogen IV concentrate.
Oh. Next question. Do women with this deficiency experience different symptoms than men?
Yes, they do. And this is related to the female genital tract. In other words, women ovulate and they have menstrual cycles as well as getting pregnant at times. Therefore, the symptoms they can develop in that particular area include abnormalities with ovulation, abnormalities with menses. They can also have problems with sexual activity, including pain with intercourse and bleeding. Women have reported to us that they have pain with menses due to shedding of lesions.
Okay. Next question. So, is there a way to test a baby before they are delivered to see if they are affected?
So let me rephrase the question. If I have a child with plasminogen deficiency, is there a way to know during my next pregnancy if my child is affected? So, few things. The chance of a baby to be affected is 25%. If we know the genetic mutation in the family, prenatal diagnosis during pregnancy can be done. It can be done the same way we test for other conditions, for example, Tay-Sachs. The question is, are we going to act upon the information? If the information would not change the course of the pregnancy, once the baby is born, the umbilical cord blood can be sent for genetic evaluation and for the plasminogen level for early diagnosis. In my opinion, the information could be relevant for couples with a previous significantly affected child, for example, a child with severe congenital hydrocephalus. I suggest that in those cases, those pregnancies be followed by high-risk OBGYN and involve a knowledgeable genetic counselor. Dr. Shapiro, anything?
I agree with that. There are ways to test infants before they're born, but there are also risks associated if the testing is invasive. So one has to be involved with a genetic counselor and a high-risk obstetrician to understand what the testing will mean to you and to perform this as safely as possible.
Okay. My next questions are based on improving knowledge of the disease. So what do I tell my local healthcare provider about this deficiency? They have never taken care of someone with this disorder.
That's a very good question. Local healthcare providers, as this is a very rare disorder, will likely have never seen anyone else with plasminogen deficiency. There are places that more information can be obtained, which Dr. Nakar will discuss after this question. I do suggest that a hematologist with specific knowledge and understanding of plasminogen deficiency also be involved in your care. That individual can serve as a touch point for your local physician to talk to about information that they're concerned about, symptoms that they should watch for, and information that should freely go back and forth between the hematologist and your local healthcare provider.
Okay. The next question. Where can I find more information about this disorder so I can advocate myself and my child?
So good information is available on the Rare Coagulation Disorders website, where an updated comprehensive review of the disorder can be freely accessed. There are articles that have been published, including a recent publication by Dr. Shapiro and her colleagues in Blood. Promedic's company website has additional information regarding the disorder.
Okay. Next question. What kind of doctor should serve as the main person to treat me or my child with this deficiency?
Again, I think a hematologist who has knowledge about plasminogen deficiency should serve as your main physician navigator for your disorder. Hematologists do take care of other coagulation disorders that, again, also have effects on many other different systems of the body. So they are used to looking at a variety of different systems that can be affected with any specific disorder.
Next one. I have never met anyone with this deficiency. Is there a place I can connect with others who have the same disorder?
So I would recommend starting with Facebook. There is a Facebook page called Plasminogen Deficiency and Ligneous Conjunctivitis Support Group that definitely you can join. I know from my patients that the site is active and some families do meet. The last time I actually checked, there were above 500 members. Dr. Shapiro, what do you think about the information that patients may have or share?
I think it's a good community for individuals to become a part of, to meet other people who are affected with this very rare disorder. Of course, one has to be careful in social media in disclosing too much information or taking another person's opinion about a certain condition as fact. Therefore, anything that comes up there that is of interest to you in terms of treatment or intervention should be shared with your hematologist who treats your disease.
So I have one more question on improving knowledge. Are there any studies in which I can participate so I can contribute to improve knowledge and care for people with this deficiency?
Yes, there is a study that Dr. Nakar and I are doing with our colleagues in Milan, Italy, Dr. Pavandi's group. This is an international study looking at plasminogen deficiency. It provides some retrospective data collection and follow-up for a period of time. Through that study, free genetic testing as well as free plasminogen levels are provided centrally. I would encourage you to look up the International Plasminogen Deficiency Study online and to discuss this with your physician so that you can determine how you can participate in this first of its kind important study on plasminogen deficiency. Through this study, we hope that we will be able to gain information to answer many of the questions posed today to which we have been unable to provide the best answers.
Dr. Shapiro, Dr. Nakar, thank you very much for your time and taking the time to answer all these questions. Thank you.
Thank you.